Now to the latest on the financial trauma infecting the new Veterans Hospital in Aurora. Late this morning, lawmakers in the U.S. House reached a deal to keep construction going. They passed a stopgap funding bill just before fleeing for their Memorial Day recess. Political specialist Sean Boyd at the hospital site in Aurora for us tonight. And Sean, this bill still needs to pass the Senate.
And Karen, they have suspended the rules in the Senate to get it done before they go on recess tomorrow. There'll be no floor debate, not even a recorded vote. The bill was just sent to every senator, and if no one, and it has to be unanimous, objects, the bill passes. But if the legislation doesn't go through by tomorrow, work here stops this weekend. The legislation lifts the spending cap on this hospital from $800 million, which the VA will hit Sunday, to $900 million, which buys it 3 more weeks. But it'll take nearly $2 billion to finish the hospital. That has tripled in cost since construction started 4 years ago.
I think there's real outrage here, as there should be. But as a combat veteran, I understand that we have an obligation to serve those who served us.
And to stop and restart construction here will drive the costs up to $200 million more. The VA offered to scale back the project, but Senator Cory Gardner says Congress wants wholesale reforms at the VA.
We're talking about a system-wide solution, policies where they eliminate the $6 billion in fraud that they admitted to in recent days, that they find out who was responsible for misusing the expense cards, that they find out who was responsible for the lack of oversight at the VA hospital in Aurora and beyond, and hold them accountable.
The VA says people who headed up the project have been replaced, but no one has been fired. Senator Michael Bennet is pressing the White House to intervene.
What I'm telling them is that it is a national problem if we have a half-finished veterans hospital sitting in Denver, Colorado, that's an outcome that does such a disservice to our veterans, not just in the Rocky Mountain region, not just in Colorado, but throughout the United States.
Now, one of the reasons the bill made it out of the House today is because it also includes a provision that says if veterans have to drive more than 40 miles to get to a VA facility, they can access private health care at the VA's expense, which could really help veterans in rural Colorado. We'll let you know if and when that bill passes. Live in Aurora, Sean Boyd, CBS 4 News.